Okay, so we're well within the third year of diagnosis, and we're at the point where I'm really realizing that this is definitely more of a marathon than a sprint, much to, my chagrin. But before we get into that and everything else that's been going on, just want to remind everyone that I'm not a doctor, so don't take anything I say here as medical advice. Secondly, we're going to be talking about prostate cancer, so if that bums you out or give you the heebie-jeebies, you've been warned. So this is an update video getting everyone up to speed on kind of the second visit for tests that I've made to Houston Methodist to visit the genitourinary oncologist there. We approached this visit a little different than we did the previous time when I had to do everything basically in the first day. So the MRI, the PSMA PeT, and all the blood work was done that first day. This time I did the blood work and the Tempest DNA test that calculates the circulating tumor cells. I did that before I got to the hospital that first day. So getting ahead of myself here, the blood work came back fine. PSA is still undetectable along with the testosterone. But my red and white blood cell counts are still pretty low. Jumping ahead even further, the doc is not worried about that. She's not so concerned. She thinks that it'll come back in time, and it's really just still the side effects from the radiation and the chemo that I'm still having, more than a year on. So that brings us to the visit to Houston Methodist itself this time. Already going in knowing that the blood work and the circulated cancer cells or tumor cells from the Tempest test continue to track in the right direction. The first day at the hospital, like last time, involved the two tests, the PSMA PeT and the MRI. We started out, again, like last time, doing the PSMA PeT. This, of course, is the gold standard test where we see where the mets are in my body by measuring how much glucose in the gallium-68 solution they inject me with is taken up by the cancerous PSMA. It's measured via what's called the standardized uptake value, or the SUV. From what I understand, values less than 2 are considered benign. Values between 2 and 4 of the SUV are considered indeterminate. It could be inflammation or low-grade cancer. Values between 4 and 5 are often considered suspicious for malignancy. And then it skips to values of 8 to 10, which are considered strongly suspicious or almost certainly cancerous. Don't ask me why there's that gap between 5 and 8. I don't know. The test itself went just like every other one I've had there. They're very professional. I was called back. The team ran an IV and they injected me with the solution. Then they left me alone in a room for about 45 minutes before we went to the actual scan. The scan itself, it took about 10 to 15 minutes, if I remember correctly, and nothing significant, and I was gone after that. The MRI was a few hours later and a little bit more involved. Unlike the last MRI scan, which was a full body scan and lasted 2 hours and 45 minutes, an experience that I'd rather not repeat again, this MRI was just of the abdomen and the pelvis. I had to prep for this by fasting for 6 hours and not having any water or anything else for the 2 hours immediately prior to the test. It also included doing a fleet enema, which is not the most comfortable preparation, but oddly refreshing in its own way. The crew also let me know that they wanted me to take that they were going to give me a glucogen injection, which they did the last time. But the last time when they gave me the glucogen injection, I'd already been in the MRI room getting the scan for about 2 hours. So I was laying down and I was in a different state of mind at that point, having been subjected to the sounds and everything and wrapped up like a burrito for 2 hours at that point. This time, They gave me the glucogen shot while in the dressing room, basically, before they take you back. So I was sitting in, and it was a significantly different experience this time. As soon as they gave me the injection, I broke out in sweats. I was soaked. I was nauseous. I was dizzy. I really felt like I was going to throw up. Thankfully, I didn't. After the glucogen injection, they called me back. They didn't wrap me up exactly like a burrito this time, but the procedure did take about 45 minutes, which was a lot better. The only complaint I had was, for whatever reason, the tech insisted on seating the earplugs they give you in my ears himself. This resulted in my left ear being fine, and then the right ear not seating correctly. So I basically felt like I spent 45 minutes at a techno concert for a band I didn't know and who couldn't keep time all that well. But I got through it. And so that was the first day. The second day was when all the work that I've been doing since the last visit paid off, and I get to find out if it did pay off or if it didn't. So here's what happened. Remember that during the last visit, it was determined that I was about 98% in remission, with the exception of 2 metastases. One of the mets being the prostate, or being on the prostate, and the other being a sclerotic area in the right pubic ramus. I'll try to post a picture of this, but this is basically, it's in the vicinity of the prostate. It's a bone that's kind of close to the tailbone that's on the pelvis. During that exam in December, the prostate had an SUV of 5.3, and the inferior pubic ramus had a metastasis, or that had an uptake of 3.1. The doc at the time said that both the MRI and the PSMA PeT showed that the bone met had signs of healing. The prostate showed clear signs of continued healing, likely due to the continued responsiveness from the radiation treatment. As a result, for example, the prostate is smaller on this go round. It's 1 centimeter now versus the 1.4 centimeters it was in December. And it has an SUV, or standardized uptake value, of 4.1 versus the 5.3 that it had on the December scan. The bony met on the ramus and the pelvis is a different story. Its SUV actually increased from 3.5 to 3.5 from 3.1. It was 3.1 last time. And the MET showed up on both scans as being of concern. So both the PSMA PET and the MRI. So that last part isn't great. Granted, these measurements are sometimes more art than science. We're talking about really small measurements here, about an increase of 0.4. And, people are doing the measurements here, not AI, not computers, and may not be the same person doing the measurement. And also remember that on the very, very first PSMA PET scan I did, this MET was clocked in with an SUV of 32.2. So remember that scale I gave you in the beginning. This is a nasty MET of going from 32.2 to 3.1, and now it's back up to 3.5. So what does this mean? I don't know. I don't know, other than the doc wants to get ahead of this, and she and I both agree that this is something that we probably need to go ahead and try to treat. This means embarking on what is called spot welding, which is a term that I've heard used by some radiological oncologists that I've heard online, and actually the most recent radiological oncologist I've seen also referred to it as spot welding. Basically, it's SBRT, which stands for stereotactic body radiation therapy, which is a highly precise form of external beam radiation therapy, which is EBRT. Without having seen a radiological oncologist about this, what I've read is this should be about 1 to 5 sessions of very high doses of radiation to this specific MET, with the goal of sparing the healthy tissue in the immediate vicinity of the metastasis itself. I have an appointment with the radiological oncologist I saw last month when I thought that I was getting some symptoms from the original, when I originally was diagnosed, who said he does do this procedure. and we're going to discuss a way forward. So not the best results, but not the worst either. And I still think we're tracking in the right direction. There's been a lot of good stuff written about the SBRT. And yes, this is the first appointment that we've had in this journey where the test showed something getting worse. But I've been aware of the spot welding, and I'm confident that if this is a viable treatment plan, that this might even help me get to the next level of healing. So I guess, what about the treatment holiday, you ask? I'm not even thinking about that, and it's really not worth talking about with this. There's a lot of stuff that still has to go on before we get to that point. Oh, and the other thing that did come out of this visit was that I am making the switch from Urleta, which I've been on since the very, very beginning. It was the very first drug that I took when I was diagnosed, and now we're switching to Nubeqa, which is supposedly the better drug as far as the side effects are concerned, and specifically with regards to crossing the blood-brain barrier, which I believe Urleta does and Nubeqa doesn't. But it is recently been approved, and a lot of the oncologists are touting its beneficial properties. So that's where we are. Of course, I'll let you know what the radiological oncologist says on Wednesday. And until then, I'll just be keeping my head up and reminding myself that, like always, anything is possible.